Hello, I'm Karen Hammond. As a registered nurse practitioner, I have been working with couples trying to conceive for more than 25 years, and I understand the stress and frustration many couples experience. These directions are meant to complement, not replace, the directions you receive from your doctor or nurse. They should be used only after receiving directions from your healthcare professional and carefully reading all of the instructions for use. Do not use Follistim AQ vial for injection unless your healthcare professional has taught you the right way to inject it and you understand everything. This video program is an educational service to patients provided by Merck and Company. Follistim AQ, phollotropin beta injection, is approved for women to help healthy ovaries to develop and release mature eggs. Follistim AQ is also for women participating in Assisted Reproductive Technology ART program to help the ovaries produce more mature eggs. Important safety information. Do not use Follistim AQ if you are allergic to recombinant human FSH products. Have a high level of FSH in your blood, indicating that your ovaries may be permanently damaged and do not work at all. Have uncontrolled thyroid, pituitary, or adrenal gland problems, are allergic to streptomycin or neomycin types of antibiotics, have a tumor of the hypothalamus, pituitary gland, breast, uterus, or ovary, are pregnant or think you may be pregnant, have heavy or irregular vaginal bleeding and the cause is not known, have ovarian cysts or enlarged ovaries not due to polycystic ovary syndrome, PCOS. Follistim AQ may cause serious side effects in women, including ovarian enlargement and ovarian hyperstimulation syndrome, OHSS. OHSS is a serious medical problem that can happen when the ovaries are overstimulated. In rare cases, it has caused death. OHSS causes fluid to build up suddenly in your stomach and chest areas and can cause blood clots to form. Call your healthcare provider right away if you have pain in your lower stomach area, nausea, vomiting, weight gain, diarrhea, decreased urine output, or trouble breathing. Follistim AQ can cause you to have fluid in your lungs, atelectasis, and trouble breathing, acute respiratory distress syndrome. Follistim AQ may increase your chance of having blood clots in your blood vessels. Blood clots can cause blood vessel problems, thrombophlebitis, stroke, loss of your arm or leg, blood clot in your lungs, pulmonary embolus, or heart attack. Follistim AQ may increase the chance of twisting of the ovaries in women with certain conditions such as OHSS, pregnancy, and previous abdominal surgery. Twisting of the ovary could cause the blood flow to the ovary to be cut off. Follistim AQ can cause multiple births. Having a pregnancy with more than one baby at a time increases the health risk for you and your babies. Discuss your chances of multiple births with your healthcare provider. A woman's age, certain sperm problems, genetic background of both parents, and a pregnancy with multiple babies can increase the chance that your baby might have birth defects. The chance of a pregnancy outside of the womb is increased in women with damaged fallopian tubes. The chance of loss of an early pregnancy may be increased in women who have difficulty with becoming pregnant at all. The most common side effects of Follistim AQ include cyst in the ovary and stomach pain. These are not all the possible side effects of Follistim AQ. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider immediately if you get worsening or strong abdominal pain. Also, call your healthcare provider immediately if this happens some days after the last injection has been given. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see accompanying important product information. Be sure that you read, understand, and follow the patient instructions for use that comes with Follistim AQ. Use Follistim AQ exactly as your healthcare provider tells you to. Your healthcare provider will tell you how much Follistim AQ to use, how to inject it, and how often it should be injected. Do not inject Follistim AQ at home until your healthcare provider has taught you the right way. Do not mix Follistim AQ with any other medicines in the same vial or in the same syringe. Do not change your dose of Follistim AQ unless your healthcare provider tells you to. Call your healthcare provider immediately if you use too much Follistim AQ. If you miss or forget to take a dose, do not double your next dose. Ask your healthcare provider for instructions. Read the patient instructions for use that comes with Follistim AQ before you start using it and each time you get a refill. There may be new information. This information does not take the place of talking with your healthcare provider about your medical condition or treatment. The injection procedure consists of several steps. Just follow all the instructions carefully. Before giving yourself the first injection, we recommend that you allow the drug to reach room temperature because injecting cold drug is likely to cause discomfort. Always check the liquid in the vial. If the solution is not clear and colorless, or it has particles in it, do not use the vial. Instead, consult your healthcare provider. This is what you will need for the injection: a Follistim AQ vial, a clean, dry surface, syringe and needle prescribed by your physician, alcohol, cotton balls or alcohol pads or swabs, sterile gauze, antibacterial soap, and a puncture-proof container to discard the used needles and other supplies. You will need to prepare the injection on a clean, dry surface. Follistim AQ vials are available in the following strengths: 75 and 150 international units of recombinant FSH. Follistim AQ is given by an injection under the skin, subcutaneous injection, or into a muscle, intramuscular injection. Use Follistim AQ as prescribed by your doctor. Your doctor will decide the dose of Follistim AQ vial, folitropin beta injection, to be given. This dose may be increased or decreased as your treatment progresses, depending on your individual type of treatment. It is important that you follow your healthcare provider's instructions exactly. Always wash your hands thoroughly with an antibacterial soap and water before you start. Flip off the protective cap on the top of the vial. Do not remove the rubber stopper. Wipe the top of the rubber stopper with an alcohol wipe. Use a fresh alcohol wipe to clean about 2 inches around your chosen injection site. We'll talk more about that in a moment. Let the alcohol dry on your skin for at least 1 minute before you inject the medicine. Use a syringe and needle that has been recommended by your healthcare professional. Attach a needle to a syringe. Carefully remove the needle cover from the needle. Pull back on the plunger to draw the amount of air into the syringe equal to the dose needed. With the vial on a flat work surface, insert the needle straight down through the rubber stopper of the Follistim AQ vial. Push the plunger of the syringe down to inject the air from the syringe into the vial of Follistim AQ. The air injected to the vial will allow the Follistim AQ to be easily withdrawn into the syringe. Keep the needle inside the vial. Turn the vial and syringe upside down and be sure that the tip of the Follistim AQ needle is in the liquid. Slowly pull back on the plunger to fill the syringe with Follistim AQ liquid to the number that matches the dose your healthcare provider prescribed. Hold the syringe with the needle pointed up. Check for air bubbles in the syringe. A small amount of air will not hurt you. If you see large air bubbles, gently tap on the side of the syringe with your finger until the air bubbles rise to the top of the syringe. Squeeze the plunger gently until all the air has been expelled from the syringe and a drop of Follistim AQ solution appears at the tip of the needle. Double check that you have the right dose in the syringe. Lay the syringe down on its side until you have selected and prepared your injection site. Follistim AQ vial is designed for injection under the skin, subcutaneously, or into the muscle, intramuscularly. Your healthcare provider will decide which type of injection is best for you. The best place for a subcutaneous injection is in the area just below the belly button or in the upper thigh. Change your injection site a little with each injection to reduce the chance of a skin reaction. Do not inject Follistim AQ into an area that is tender, red, bruised, or hard. Clean the skin with an alcohol wipe where the injection is to be made. Be careful not to touch the skin that has been wiped clean. Pick up the prepared syringe and needle and hold it in the hand that you will use to inject the medicine. Use the other hand to pinch a fold of skin at the cleaned injection site. Do not touch the cleaned area of skin. Hold the syringe like you would a pencil. Use a quick dart-like motion to insert the needle either straight up and down, 90-degree angle, or at a slight angle, 45-degree angle. Once the needle is properly placed, slowly pull back on the plunger. If blood comes into the syringe, do not inject Follistim AQ because the needle might have entered a blood vessel. If this happens, remove the syringe. Cover the injection site with an alcohol pad and apply pressure. Discard the original needle and replace it with a new sterile needle. Then repeat the injection at a different site. If no blood is seen and the needle is properly placed, push the plunger slowly and steadily so the solution injects properly. Pull the needle out quickly and apply pressure at the site with an alcohol pad for a few seconds. Maintain pressure, but gently massage the site to help disperse Follistim AQ solution and relieve any discomfort. Use the syringe, needle, and Follistim AQ vial only once. Dispose of them properly in a puncture-proof container. For each injection, prepare a new syringe of Follistim AQ using the instructions above. Remember to clean a new area of skin. Congratulations! You have now successfully administered your first Follistim AQ vial dose. If your healthcare provider has recommended an intramuscular injection, the best site for the injection is the upper outer quadrant of the buttock muscle on either side. You will need to ask another person to give you your Follistim AQ injection intramuscularly. When giving an intramuscular injection, follow your healthcare provider's instructions about changing the site for each injection. This will help lower your chances of having a skin reaction. Do not inject Follistim AQ into an area that is tender, red, bruised, or hard. Relax the muscle first by shifting your weight to the leg opposite the muscle to be injected. Clean the skin with an alcohol wipe. Do not touch the skin that has been wiped. Stretch the skin of the buttock. This helps the needle go in more easily and pushes the tissue under the skin out of the way, which helps the solution disperse correctly in the muscle. Hold the syringe like a pencil. Use a quick dart-like motion to insert the needle to the hub at a 90-degree angle to the skin surface. Pull back gently on the plunger. If the needle is correctly positioned, it will be difficult to draw the plunger back. If any blood is drawn into the syringe, do not inject Follistim AQ because the needle tip has penetrated a blood vessel. If this happens, remove the syringe, cover the injection site with an alcohol pad, and apply pressure. The site should stop bleeding within a minute or two. Do not put the needle cover back on the needle. Discard the original needle and replace it with a new sterile needle. Then repeat the injection at a different site. Once the needle is properly placed, depress the plunger slowly and steadily so the solution injects properly. Pull the needle out quickly and apply pressure to the site with an alcohol pad. Maintain pressure, but gently massage the site to help disperse the Follistim AQ solution and relieve any discomfort. Use the syringe, needle, and Follistim AQ vial only once. Dispose of them properly in a puncture-proof container. Check with your healthcare provider or pharmacist for instructions about the right way to throw away used syringes and needles. There may be special local or state laws about how to throw away used syringes and needles. Do not throw away used syringes and needles in the household trash and do not recycle them. Put used and empty Follistim AQ syringes, needles, and vials in a closable, puncture-resistant container. You may use a sharps container, such as a red biohazard container, a hard plastic container with a screw-on cap, such as an empty detergent bottle, or in a metal container with a plastic lid, such as a coffee can. When the container is full, tape around the cap or lid to make sure the cap or lid does not come off. When your injection is given by another person, this person must also be careful when removing the syringe and needle and disposing of the syringe and needle to prevent accidental needle stick injury and passing infection. Congratulations! You have now successfully administered your first Follistim AQ vial dose. We know fertility treatment can be very demanding. Hopefully, though, your treatment with Follistim AQ vial injection will lead to a successful pregnancy. If you have any questions, ask your healthcare provider for more information or call Merck & Company at 1-866-836-5633 or visit their website at www.follistim.com. For support services, you can visit www.fertilityjourney.com.